Hello, welcome back to Dementia Q&A, where we try to answer your questions about dementia in about 5 minutes with as little medical jargon as possible. I'm Dr. Marc, an internist and geriatrician here in Louisville, Kentucky. This is week 2 of our series on care settings, places where people with dementia might live, and care services, what services they might qualify or benefit from. Last week, we talked about the difference between skilled and unskilled care. That's relevant this week as we try to answer the question, what is the difference between home health and home care? If you have experience with those, I'd love to hear about it. Please drop me an email at drmarc@dementiaqa.com or just put it in the comments section below. It's obvious why home health and home care are so confusing. The first reason is people call them by a zillion different names. You might hear people talking about home health as visiting nurses, home PT, rehab at home, and you might hear people talking about home care as private duty nursing, even though it's not a nurse, aides and attendants, home companions, or sometimes home health aides, even though home health is something different. Let's try to tease the two apart. I'll put a link to a one-page document that spells some of this out on paper. That might be helpful. Let's start with home health. Home health is a skilled medical service provided at home by trained, licensed professionals, typically nurses or physical therapists. It's focused on a particular medical problem, things like wounds, infections, people who are recovering after being hospitalized or after a major surgery, or perhaps people who have complex medical devices in the home, and that requires a lot of training and education. In general, home health is reserved for people who are either homebound or have so much difficulty getting out of the house to the clinic for care that we think we can provide some of the care in the home for a time until they are strong enough to get out. In general, these nurses and therapists will be in the house once or twice a week, which means they're not there on a daily basis. So they're not really focused on things like meal preparation, light housework around the home, and showering and bathing. All of the care in home health needs to be certified by and overseen by a physician. That physician is responsible for lab tests, lab test results, the medications being given, and the orders. Let's contrast all of that to home care. Home care is unskilled care provided to our loved ones to support them in their activities of daily living. We know that in dementia, people start to make more and more errors and start to require more and more help as the disease progresses. That's what home care is designed to do. It does not require a skilled, licensed, trained nurse or therapist, and it generally needs to be almost every day, as you already know probably. In general, it does not require oversight by or certification by a physician, with a few exceptions. Because home health is a medical skilled service, it's generally paid for by Medicare or by private insurance plans. On the other hand, home care is generally either paid for or provided by the families themselves. There are some long-term care insurance policies that will have home care built in, and there are certain states where Medicaid will compensate people for the care they're providing their loved ones, depending on the state. So you need to check it out for the state that you're in. Two things you need to know about home health and home care. First, they are not designed to replace your primary care physician. We'll do a video in a few weeks about home-based primary care, which is becoming more and more common these days. Second, home health and home care are not mutually exclusive. They can be going on at the same time, and they often are. Someone who has a home care attendant all the time might qualify for some home health for some reason or another, maybe for a few weeks or a month. Likewise, someone who's discharged from a hospital might qualify for home health for the next 3 to 4, 5, 6 weeks. They might hire a home care attendant to come into the house and help them get things done while they're recuperating. So the two services can be happening at the same time, and often are. I hope that the distinction between home health and home care is useful for you as you think about care you're providing for a loved one or something you might need for yourself. Thanks for all you're doing to care for someone with dementia today. Thanks for watching, and I'll see you all next week.